Pregnancy and gestational diabetes is an issue, and you should know by now what diabetes is that the inability to control blood sugar levels. And this is another form of diabetes called gestational diabetes, so during pregnancy. So the incidence is about 10% of women will get some form of gestational diabetes. And 40% of women with gestational diabetes mellitus, so GDM, gestational diabetes mellitus, will develop type 2 diabetes within 4 years. So once they've had the baby, they do have a high chance of getting type 2 diabetes after the pregnancy. So again, it's a big issue for women. And it is related to obesity, so the BMI of the woman, and the sedentary lifestyle leading up to the pregnancy. So it tends to be that these type of women will have a high incidence of gestational diabetes. So this is an interesting graph where it's got the percent of gestational diabetes mellitus in women, and down the bottom here we've got the body mass index, and we've got no exercise and exercise graphs. So notice that at low BMIs, then the incidence of gestational diabetes is very low, around 1%. So we get around 18, BMI of 18 to 20, then we get to 21 to 23, which is normal. So we're still in the normal range and still only about 2%. Then once we start to get into the overweight range, which is above 25, then it starts to increase. But the two lines, the no exercise, still meet each other. But then at around 30, where we're getting into the obese range, so a BMI of 30, then the group that doesn't exercise really takes off. And so the percentage of those getting gestational diabetes really increases the higher the BMI. Whereas those who are still obese, but they do exercise, it's much, much lower. The incidence about half. So the take-home message is if the pregnant woman is overweight or obese, they're still at a better chance of not getting gestational diabetes if they're doing exercise before and during the pregnancy. So it doesn't really the weight is an issue, but it's can be offset by doing exercise. Ideally, you want them down this end in the normal range, doing exercise to reduce their incidence of gestational diabetes. But if they're overweight and obviously during pregnancy they can't go on a diet, so you get them doing exercise to reduce their chances of getting gestational diabetes. So possible mechanisms, there's a diabetic genic effect, so of hormones, so estrogen, prolactin, cortisol, progesterone, all these hormones are really in high concentrations during pregnancy, and this can affect the tissues and their sensitivity to insulin. So you need more insulin to try to get the glucose in. And in severe cases, the mother won't be able to absorb much of the glucose she ingests. 39% of the gestational diabetes patients will need some sort of insulin therapy during pregnancy. So again, that's another stress, another cost as well during the pregnancy that could be avoided by having the mothers doing exercise. So glucose, as I said before, is the primary fuel for the fetus during growth. Long bouts of exercise may lead to hypoglycemia for the mother because the glucose is taking most of the fetus is taking most of the glucose. So in this graph here, you've got concentration of glucose in millimoles, and you've got pregnant and non-pregnant women. And notice that the pregnant woman during an exercise bout lasting an hour and a half, their glucose really starts to drop down. And it gets down into about the 3.5 millimole range, which is getting into the hypoglycemic range, whereas the non-pregnant remains fairly stable at around 4.5, which is normal. Then during rest, it increases a bit. So what that says is that the mother is being starved of glucose because the fetus is consuming it, and that can lead to hypoglycemia. And the effects of hypoglycemia is that the brain is not getting enough glucose, the mother's not getting enough glucose, and so she might start to feel faint, fatigued, and this is when you need to supplement her, give her some glucose, some lollies, some sugar drinks, and so on. Now, exercise does improve the insulin sensitivity. So by contracting muscle, that allows glucose to move into the muscle of the mother, even without insulin. Okay, so exercise is really important. Large muscle mass required. So we're looking at walking, swimming, cycling, those sorts of things. And at least 45 minutes at 55% VO2 max. Another condition that is reasonably prevalent in pregnancy is pre-eclampsia. Now, eclampsia is a gradual increase in blood pressure and protein excretion in the urine during pregnancy. And in some cases, in full-blown eclampsia, the blood pressure can be so high that it can cause mortality in women. Like, it can be extremely dangerous. And so the treatment is to essentially lie in bed for the last few months of the pregnancy, so that there's no spikes in blood pressure doing daily activities that might result in a stroke or heart attack or something like that. So it can be extremely high, 200 plus millimeters of mercury at rest for systolic blood pressure. So they need to be treated in a medical situation. This can happen in 10% of pregnancies, so again, reasonably prevalent. Now, the cause is not fully understood, the underlying mechanisms, but there are a few theories. One is that the placenta is not lodged into the wall of the womb, so that it's not implanted well. It's shallow implantation, and this can release hormones and chemical metabolites that signal an inflammatory response. And that can cause inflammation, and then part of that is a higher blood pressure due to this inflammation acting on the vascular endothelial cells. So the endothelial cells are the ones that line the inside of the arteries and so on, and these can result in the blood vessels becoming less flexible and requiring higher pressure to pump the same amount of blood. Another possible mechanism is that the paternal antigens, so these, remember that a baby is half mother, half father. So the father side is a foreign entity inside the mother, and so the mother's immune system will try to attack the fetus. But the mother will has mechanisms to suppress the immune system to stop this from happening. However, in some cases, you might have the suppression is not adequate, and that can lead to a whole cascade of physiological effects. One of those is higher blood pressure.